Karibu sana. Today, I want to take us through cholera outbreak in Africa, and I'll tell you why this is important now. In 2023, at the heart of Hammanskraal, about 100 kilometers south of Johannesburg, there was a cholera outbreak. Joy, a mother of two, almost lost her son. Now listen to her story as she tells it. She says, "I overheard my neighbors discussing the outbreak, but I never thought that it will affect me and my children. The reality of cholera spread set in after I dropped my son in school one morning, only for him to return home in pain and in tears. His stomach was gripping by cramps and he couldn't stop crying and vomiting. Luckily for Joy, she could take her son to the hospital in time. There, the boy received the vital rehydration drips and medications, and within a few days, he began to improve and recover quickly. Now, 17 people in that community were not as fortunate as Joy's son. They died from that cholera-related diseases, and more 177 people were hospitalized. Within a few days of the first reported case, the situation has escalated so much to the point where the government themselves had to designate Hammanskraal as a cholera hot zone and called for UNICEF and WHO to come to their intervention. We see similar pattern of cases in other African countries. In 2021, Nigeria reported over 111,000 suspected cases of cholera and nearly 3,600 deaths in just 1 year. In Cameroon, between the 29th of October 2021 and 30th of April 2022, a total of 6,652 suspected cases, including 134 deaths, were reported. In February of 2023, the outbreak had already claimed the lives of over 1,400 people in Malawi, and more than 45,400 cases were recorded and had an overall fatality case rate of 3.21%. This is more than 3 times the emergency threshold, according to UNOCHA. And if we follow the global disease outbreak pattern, especially in war-torn and crisis-prone environments, it is easy for you to relate to this next country that I'm going to talk about right now. Sudan. Sudan is in the grips of its worst outbreak in years. Over 100,000 cases has already been reported, and nearly 4,000 people have died as of mid of 2025. And this is fueled by the civil war, displacement, the collapse of sanitation system. This number sounds like headlines from centuries past, but they are our reality today in Africa. So let us uncover the truth behind cholera in Africa and what they really say about rural health. Cholera has devastated many African countries for decades, so it's no more a random outbreak. In fact, epidemiologists will tell you that it follows a haunting pattern every rainy season. In rural communities with poor sanitation, limited clean water, and weak health infrastructure, that is where cholera thrives. The World Health Organization estimates that annually, over 1.3 to 4 million cases of cholera will be reported worldwide, with up to 140,000 deaths. Significant portion of these deaths occur in sub-Saharan Africa. Yet, this cycle continues to repeat itself with devastating regularity. The story we heard recently about Mozambique is just unreal. Over 100 desperate families who were fleeing the cholera outbreak in their community by boats got drowned in a shipwreck. What is their crime? they were trying to escape cholera. Therefore, we cannot just say that cholera is a mere disease. It is also an infrastructural problem. And let me break it down for you. Children and young people are mostly the vulnerable groups. Children under 15 comprise 50% of all the cases of cholera outbreak in South Sudan. In Zambia, children, particularly those that are under 15, they make up approximately 52% of all cholera outbreaks in there. In the Democratic Republic of Congo DRC, children under 5 account for 25.6% of all cholera cases, and in Angola, 1/3 of all cholera cases affect children aged 6 to 14, with another 21.7% affecting teenagers that are between 15 to 24. Why does this matter for African rural communities? The truth is that cholera is not just a waterborne disease. It is also a reflection of the state of our rural health systems. Number one, there is always the lack of clean water. Since that accident with Joy and his son, she has continued to purchase purified water, what we call pure water, to ensure that at least her family have either boiling water or they drink from that purified water. However, the financial burden of acquiring safe water on a daily basis directly weighs heavily on her finances, and waiting for water deliveries to reach her community also presents a challenge due to her work, because sometimes the water are delivered when she is at work. Over 400 million people in sub-Saharan Africa still lack access to basic drinking water as at today, and this is from UNICEF data. The second one is weak health infrastructure. Most rural clinics lack rehydration supplies or even clean IV fluids when outbreaks strike. So if rural clinic has these basic things and have clean waters, have medicine, have trained staff, then cholera outbreak wouldn't just be this much an issue, because it would be easy to contain or even prevent. In Nigeria, the most recent outbreak, despite having over 1,300 cases across the 30 states, there is just enough emergency fund to cover about 9% of the response need. And the last but not the least is delayed reporting. Most of these outbreaks happen in rural communities, and they spread silently until the national authorities get to hear about it. Before then, it becomes already too late to respond, and many people would have died. Cholera is a hidden threat beyond the villages. When cholera breaks out in rural areas, urban dwellers may feel like, they are safe. But history has shown us otherwise. Pathogens do not respect geography. Infectious disease spread along trade routes, highways, rivers, and borders. In other words, if rural communities cannot stop cholera, cities will not escape it. So we have to work together to get to the solution. And to fight cholera and the next rural health crisis in Africa, we need urgent and practical measures that include strengthening the primary health care systems and centers, equipping them with essential medicines and other life-saving resources. We also need to improve telemedicines and telehealth services that connect and strengthen rapid response and treatment supplies from the urban and the rural area. And then we have to strengthen data collection and data dissemination. In closing, I would say that behind every cholera statistics that you see lies a family without a clean water, a clinic without a medicine, a child without a safe school. Silence is not neutrality, it is complicity. Therefore, we must strengthen rural health for our collective safety. My name is Chinasa Imo, and this is What About Rural Health, where the truth we always ignore find their way to the surface. Thank you for listening. Click to subscribe to all our channels to keep up with this monologue. Thank you very much. Bye.